Hello students, today we will be talking about the nutritional management of thyroid gland disease. The thyroid gland is about 2 inches long butterfly shaped organ and lies in front of your throat below the prominence of thyroid cartilage, sometimes called the Adam's apple. The thyroid has 2 sides called lobes that lie on either side of your windpipe and is usually connected by a strip of thyroid tissue known as an isthmus. Some people do not have an isthmus and instead have 2 separate thyroid lobes. Though the thyroid is small, it is a major gland in the endocrine system and affects nearly every organ in the body. So, it releases hormones that control metabolism, the way your body uses energy. The thyroid hormones regulate vital body functions including breathing, heart rate, central and peripheral nervous systems, body weight, muscle strength, menstrual cycles, body temperature, cholesterol levels and much more. Now, we will see how the thyroid gland works. The thyroid is part of the endocrine system which is made up of glands that produce, store and release hormones into the bloodstream so the hormones can reach the body cells. The thyroid gland uses iodine from the foods eaten to make 2 main hormones. One is triiodothyronine called as T3 hormone and thyroxine which is called T4 hormone. It is important that T3 and T4 levels are neither too high nor too low. 2 glands in the brain, the hypothalamus and the pituitary, communicate to maintain these T3 and T4 balance. The hypothalamus produces TSH releasing hormone, that is TRH, that signals the pituitary to tell the thyroid gland to produce more or less of T3 and T4 by either increasing or decreasing the release of a hormone called thyroid stimulating hormone or TSH. Now, why do we need a thyroid gland? T3 and T4 travel in the bloodstream to reach almost every cell in the body. The hormones regulate the speed with which the cells or the metabolism work. For example, T3 and T4 regulate heart rate and how fast the intestines process food. So, if T3 and T4 levels are low, heart rate may be slower than normal and may lead to constipation and weight gain. If T3 and T4 levels are high, one may have a rapid heart rate and diarrhea and weight loss. Listed below are the other symptoms of too much T3 and T4 in the body or hyperthyroidism. Those are anxiety, irritability or moodiness, nervousness, hyperactivity, sweating or sensitivity to higher temperatures, hand trembling or shaking, hair loss, missed or light menstrual periods. The following are the other symptoms of too little T3 and T4 in your body, that is hypothyroidism. There are trouble sleeping, tiredness and fatigue, difficulty concentrating, dry skin and hair, depression, sensitivity to cold temperature, frequent heavy periods, joint and muscle pain. As we have seen from our overview of normal thyroid physiology, the thyroid gland produces T3 and T4, but this production is not possible without stimulation from the pituitary gland, that is TSH, which in turn is also regulated by the hypothalamus TSH releasing hormone. Now, with radioimmunoassay techniques, it is possible to measure circulating hormones in the blood very accurately. Now, knowledge of this thyroid physiology is important in knowing what thyroid tests or tests are needed to diagnose different diseases. No one single laboratory test is 100% accurate in diagnosing all types of thyroid disease. However, a combination of 2 or more tests can usually detect even the slightest abnormality of thyroid function. For example, a low T4 level could mean a diseased thyroid gland or a non-functioning pituitary gland which is not stimulating the thyroid to produce T4. Since the pituitary gland would normally release TSH, if the T4 is low, a high TSH level would confirm that the thyroid gland and not the pituitary gland is responsible for the hypothyroidism. If the T4 is low and TSH is not elevated, the pituitary gland is more likely to be the cause for the hypothyroidism. Of course, this would drastically affect the treatment since the pituitary gland also regulates the body's other glands like adrenals, ovaries and testicles, as well as controlling growth in children and normal kidney function. Pituitary gland failure means that the other glands may also be failing and other treatment just than thyroid may be necessary. The most common cause for pituitary gland failure is a tumor of the pituitary, and this might also require surgery to remove. When T3 and T4 levels are low in the blood, the pituitary gland releases more TSH to tell the thyroid gland to produce more thyroid hormones. If T3 and T4 levels are high, the pituitary gland releases less TSH to the thyroid gland to slow production of these hormones. The following are the commonly used thyroid tests. Measurement of a serum thyroid hormones, that is of T4, by radioimmunoassay. It is the most used thyroid test of all. It is frequently referred to as T7, which means that a resin T3 uptake (RT3U) has been done to correct for certain medications such as birth control pills, other hormones, seizure medication, cardiac drugs or even aspirin that may alter the routine T4 test. The T4 reflects the amount of thyroxine in the blood. If the patient does not take any type of thyroid medication, this test is usually a good measure of thyroid function. A measurement of serum thyroid hormones, T3 by radioimmunoassay. As stated on our thyroid hormone production page, thyroxine T4 represents 80% of thyroid hormone produced by the normal gland and generally represents the overall function of the gland. The other 20% is triiodothyronine measured as T3 by radioimmunoassay. Sometimes the diseased thyroid gland will start producing very high levels of T3 but still produce normal levels of T4. Therefore, measurement of both hormones provides an even more accurate evaluation of thyroid function. Now, coming to thyroid binding globulin test. Most of the thyroid hormones in the blood are attached to a protein called thyroid binding globulin. If there is an excess or deficiency of this protein, it alters the T4 or T3 measurement but does not affect the action of the hormones. Now, if a patient appears to have normal thyroid function but an unexplained high or low T4 or T3, it may be due to an increase or decrease of TBG or thyroid binding globulin. Direct measurement of TBG can be done and will explain the abnormal value. Excess TBG or low levels of TBG are found in some families as a hereditary trait. It causes no problem except falsely elevating or lowering the T4 level. Now, these people are frequently misdiagnosed as being hyperthyroid or hypothyroid, but they have no thyroid problem and need no treatment. TRH test. In normal people, TSH secretion from the pituitary can be increased by giving a shot containing TSH releasing hormone. TRH, the hormone released by the hypothalamus, which tells the pituitary to produce TSH. A baseline TSH of 5 or less usually goes up to 10 to 20 after giving an injection of TRH. Patients with too much thyroid hormone will not show a rise in TSH when given TRH. The new sensitive TSH test has eliminated the necessity of performing a TRH test in most clinical situations. Next, the iodine uptake scan, a means of measuring thyroid function to measure how much iodine is taken up by the thyroid gland. Remember, cells of thyroid normally absorb iodine from our bloodstream obtained from foods we eat and use it to make the thyroid hormone. Coming to thyroid scan, Taking a picture of how well the thyroid gland is functioning requires giving a radioisotope to the patient and letting the thyroid gland concentrate the isotope. Therefore, it is usually done at the same time that the iodine uptake test is performed. Although other isotopes such as technetium will be concentrated by thyroid gland, these isotopes will not measure iodine uptake, which is what we really want to know because the production of thyroid hormone is depending upon absorbing iodine. It has also been found that thyroid nodules that concentrate iodine are rarely cancerous. This is not true if the scan is done with technetium. Therefore, all scans can now done with radioactive iodine. Both of the scans above show normal sized thyroid glands, but the one on the left has a hot nodule in the lower aspect of the right lobe, while the scan on the right has a cold nodule in the lower aspect of the left lobe. Pregnant women should not have thyroid scans performed because the iodine can cause development troubles within the baby's thyroid gland. Two types of thyroid scans are available. A camera scan is performed most commonly, which uses a gamma camera operating in a fixed position, viewing the entire thyroid gland at once. Thyroid scans are useful for the following reasons: identifying nodules and determining if they are hot or cold. Next, coming to thyroid ultrasound. The thyroid ultrasound refers to the use of high frequency sound waves to obtain an image of thyroid gland and identify nodules. It tells if a nodule is solid or a fluid filled cyst, but it will not tell if a nodule is benign or malignant. Next is the thyroid antibodies. The body normally produces antibodies to foreign substances such as bacteria. However, some people are found to have antibodies against their own thyroid tissue, a condition known as Hashimoto's thyroiditis, associated with high level of these thyroid antibodies in the blood. Next is the thyroid needle biopsy. Now, this has become the most reliable test to differentiate the cold nodule that is cancer from the cold nodule that is benign. Hot nodules are rarely cancerous. Do I need to stop taking my thyroid pills for these tests? For this, now since euthyrox or Synthroid and most other thyroid pills behave exactly as normal human thyroid hormone, they are not rapidly cleared from the body as other medications are. Now, most thyroid pills have a half-life of 6.7 days, which means they must be stopped for 4 to 5 weeks before accurate thyroid testing is possible. Coming to the disorders of the thyroid, the most common thyroid condition is hypothyroidism or underactive thyroid. In United States, hypothyroidism usually is caused by an autoimmune response known as Hashimoto's disease or autoimmune thyroiditis. As with all autoimmune diseases, the body mistakenly identifies its own tissues as an invader and attacks them until the organ is destroyed. This chronic attack eventually prevents the thyroid from releasing adequate levels of hormones T3 and T4, which are necessary to keep the bodies functioning properly. The lack of these hormones can slow down metabolism and cause weight gain, fatigue, dry skin and hair, and difficulty concentrating. Hashimoto's affects approximately 5% of the US population and is 7 times more prevalent in women than men and generally occurs during middle age. Hypothyroidism is a condition in which the body lacks sufficient thyroid hormone. Since the main purpose of thyroid hormone is to run the body's metabolism, it is understandable that people with this condition will have symptoms associated with slow metabolism. The estimates vary, but approximately 10 million Americans have this common medical condition. In fact, as many as 10% of women may have some degree of thyroid hormone deficiency. Hypothyroidism is more common than you would believe, and millions of people are currently hypothyroid and don't know it. Causes of hypothyroidism. There are mainly two common causes of hypothyroidism. The first is a result of previous or currently ongoing inflammation of the thyroid gland, which leaves a large percentage of cells of thyroid damaged or dead and incapable of producing sufficient hormone. The most common cause of thyroid gland failure is called autoimmune thyroiditis, also called the Hashimoto's thyroiditis, a form of thyroid inflammation caused by the patient's own immune system. The second major cause is a broad category of medical treatments. The treatment of many thyroid conditions warrants surgical removal of a portion or all of the thyroid gland. If the total mass of thyroid producing cells left within the body are not enough to meet the needs of the body, the patient will develop hypothyroidism. Remember, this is often the goal of surgery for thyroid cancer. But at other times, the surgery will be to remove a worrisome nodule, leaving half of the thyroid in the neck undisturbed. Sometimes, this remaining thyroid lobe and isthmus will produce enough hormone to meet the demands of the body. For other patients, however, it may become apparent years later that the remaining thyroid just can't quite keep up with demand. Similarly, goiters and other thyroid conditions can be treated with radioactive iodine therapy. The aim of the radioactive iodine therapy for benign conditions is to kill a portion of thyroid to prevent goiters from growing larger or producing too much hormone. Occasionally, the result of radioactive iodine treatment will be that too many cells are damaged, so the patient often becomes hypothyroid within a year or two. However, this is usually greatly preferred over the original problem. Now, there are several other rare causes of hypothyroidism, one of them being a completely normal thyroid gland that is not making enough hormone because of a problem in the pituitary gland. If the pituitary does not produce enough thyroid stimulating hormone, then the thyroid simply does not have the signal to make hormone. So, it doesn't. Each individual patient may have any number of these symptoms, and they will vary with the severity of the thyroid hormone deficiency and the length of time the body has been deprived of the proper amount of hormone. You may have one of these symptoms as your main complaint, while another will not have that problem at all and will be suffering from an entirely different symptom. So, most people will have a combination of these symptoms. Occasionally, some patients with hypothyroidism have no symptoms at all, or they are just so subtle that they go unnoticed. If these symptoms are present, doctors should be consulted. Additionally, need to seek the skills of an endocrinologist. If already has been diagnosed and treated for hypothyroidism and continue to have any or all of these symptoms, then need to discuss it with physician. Potential dangers to be seen in hypothyroidism. Because the body is expecting a certain amount of thyroid hormone, the pituitary will make additional thyroid stimulating hormone TSH in an attempt to entice the thyroid to produce more hormone. This constant bombardment with high levels of TSH may cause the thyroid gland to become enlarged and form a goiter, termed as compensatory goiter. Left untreated, the symptoms of hypothyroidism will usually progress. Rarely, complications can result in severe life-threatening depression, heart failure, or coma. Hypothyroidism can often be diagnosed with a simple blood test in some persons. However, it is not so simple and more detailed tests are needed. Most importantly, a good relationship with a good endocrinologist will almost surely be needed. Hypothyroidism is completely treatable in many patients simply by taking a small pill once a day. However, this is a simplified statement. It is not always so easy. There are several types of thyroid hormone preparations, and one type of medicine will not be the best therapy for all patients. Many factors will go into the treatment of hypothyroidism, and it is different for everybody. Next, coming to the hyperthyroidism. Hyperthyroidism or overactive thyroid gland is another common thyroid condition. The most prevalent form is Graves' disease, in which The body's autoimmune response causes the thyroid gland to produce too much T3 and T4. Symptoms of hypothyroidism can include weight loss, high blood pressure, diarrhea, and a rapid heartbeat. Graves' disease also disproportionately affects women and typically presents before the age of 40. Hypothyroidism has a number of causes and fortunately a number of treatment options. It is important to talk to doctor if some symptoms of hyperthyroidism are present. Now, causes of hypothyroidism. The thyroid gland makes the hormones thyroxine and triiodothyronine that plays an important role in the way whole body functions. If thyroid gland makes too much of T3 and T4, this is defined as hypothyroidism. The most common cause of hyperthyroidism is the autoimmune disorder Graves' disease. In this disorder, the body makes an antibody, a protein produced by the body to protect against a virus or bacteria, called thyroid stimulating immunoglobulin, that is TSI, that causes the thyroid gland to make too much thyroid hormone. Graves' disease runs in families and is more commonly found in women. Hyperthyroid is also may be caused by a toxic nodule or multinodular goiter, which are lumps or nodules in the thyroid gland that cause the thyroid to produce excessive amounts of thyroid hormones. In addition, inflammation of the thyroid gland causes thyroiditis resulting from a virus or a problem with the immune system may temporarily cause symptoms of hyperthyroidism. Finally, some women may develop hyperthyroidism during pregnancy or in the first year after giving birth. To diagnose, hyperthyroidism is diagnosed based on symptoms, physical exam, and blood tests to measure levels of thyroid stimulating hormone and thyroid hormones T3 and T4. Doctor may also decide to order either an ultrasound or a nuclear medicine scan of thyroid to see if it has nodules or whether it is inflamed or overactive. Treatment of hyperthyroidism. Hyperthyroidism can be treated with anti-thyroid medications that interfere with the production of thyroid hormones. Primarily, methimazole, propylthiouracil is now used only for women in first trimester of pregnancy. Another option is radioactive iodine therapy to damage the cells that makes thyroid hormones. In rare cases in which women do not respond to or have side effects from these therapies, surgery to remove the thyroid, either one part of the entire gland, may be necessary. So, the choice of treatment will depend on the severity and underlying causes of symptoms, age, whether pregnant, other conditions, and the potential side effects of the medication. In addition to these treatments, doctor may also prescribe beta blockers to block the effects of thyroid hormones on the body. For example, beta blockers help slow down a rapid heart rate and reduce hand tremors. Graves' disease is named for the doctor who first described it in Ireland, Robert J. Graves. He noticed it in a patient in 1835. Graves' disease is a type of autoimmune problem that causes the thyroid gland to produce too much thyroid hormone, which is called hyperthyroidism. Graves' disease is often the underlying cause of hyperthyroidism. Thyroid gland and the autoimmune problems of which there are many different types developing when immune system causes disease by attacking healthy tissues. Researchers do not completely understand what causes autoimmunity, although there seems to be a genetic connection as cases of Graves' disease tend to turn in families. For unknown reasons, like many autoimmune diseases, Graves is also more likely to affect women than men. The key nutrients in the management of thyroid diseases. Many nutritional factors play a role in optimizing thyroid function. However, both nutrient deficiencies and excesses can trigger or exacerbate symptoms. Working in collaboration with a physician is ideal to determine nutritional status for optimal thyroid health. First is the iodine. Iodine is a vital nutrient in the body and essential to thyroid function. Thyroid hormones are comprised of iodine. While autoimmune diseases is the primary cause of thyroid dysfunction in the United States, Iodine deficiency is the main cause worldwide. Iodine intake often isn't readily apparent on a dietary recall since the amount in foods is largely dependent on levels in the soil and added salt. However, Schindler says clients taking iodine tablets are a red flag. Frequent intake of foods such as seaweed or an avoidance of all iodized salt may serve as signs that further exploration is needed. Next is the vitamin D. Vitamin D deficiency is linked to Hashimoto's according to one study showing that more than 90% of patients studied were deficient. However, it is unclear whether the low vitamin D levels were the direct cause of Hashimoto's or the result of the disease process itself. Hyperthyroidism, particularly Graves' disease, is known to cause bone loss, which is compounded by the vitamin D deficiency commonly found in people with hyperthyroidism. This bone mass can be regained with treatment for hyperthyroidism, and experts suggest that adequate bone building nutrients such as vitamin D are particularly important during and after treatment. Next is the selenium. The highest concentration of selenium is found in the thyroid gland, and it has been shown to be a necessary component of enzymes integral to thyroid function. Selenium is an essential trace mineral and has been shown to have a profound effect on the immune system, cognitive function, fertility in both men and women, and mortality rate. Next is the vitamin B12. Studies have shown that about 30% of people with ATD experience a vitamin B12 deficiency. Food sources of B12 include mollusks, sardines, salmon, organ meats such as liver, muscle meat, and dairy. Vegan sources include fortified cereals and nutritional yeast. Severe B12 deficiency can be irreversible, so it's important for dietitians to suggest clients with thyroid disease have their levels tested. Then next is the Goitrogens. Cruciferous vegetables such as broccoli, cauliflower, and cabbage naturally release a compound called goitrin when they are hydrolyzed or broken down. Goitrin can interfere with the synthesis of thyroid hormones. However, this is usually a concern only when coupled with an iodine deficiency. Heating cruciferous vegetables denatures much or all of this potential goitrogenic effect. Soy is another potential goitrogen. The isoflavones in soy can lower thyroid hormone synthesis, but numerous studies have found that consuming soy doesn't cause hypothyroidism in people with adequate iodine stores. Food supplements and medication interactions. When it comes to thyroid medications, it is important for us to know the medications which interact with common nutritional supplements. Calcium supplements have the potential to interfere with proper absorption of thyroid medications. So, patients must consider the timing when taking both. Studies recommend spacing calcium supplements and thyroid medications by at least 4 hours. Coffee and fiber supplements lower the absorption of thyroid medication. So, patients should take them 1 hour apart. Dietitians should confirm whether clients have received and are adhering to these guidelines for optimal health. The last is the exercise. A discussion on thyroid disease and good health isn't complete without stressing the importance of physical activity. With hypothyroid patients, certainly exercise can help with weight gain, fatigue, and depression. With hyperthyroid, anxiety and sleep disturbances are so common, and exercise can help regulate both. In addition to the obvious impact exercise has on weight and metabolism, a study of patients with Graves' disease found that a structured exercise program showed dramatic improvement in the fatigue levels, and significantly more patients were able to successfully stop taking anti-thyroid medications without a relapse. Since fatigue can be a barrier to exercise, Lilienfeld and Skinder recommend patients use a pedometer as a tool for a tangible source of structure and motivation. Now, tying it all together, thyroid disease represents unique challenges due to undecided weight changes, significant cardiovascular risks, and symptoms such as fatigue, mood changes, and gastrointestinal upset, which can hinder the development of healthful behaviors. It is vital that Dietitians focus on setting realistic goals for heart healthy changes and regular exercise when counseling clients. With so many potential nutrient deficiencies and interactions with medications and supplements, it will be important for dietitians to coordinate with their clients' healthcare team for optimal health outcomes. Thank you.